Hi guys, it's Tip of the Week Tuesday, and I'm here today to talk to you about informed consent and your patient rights, what it is and what it's not. I've been so saddened recently to hear stories from my sisters, my friends, my clients of experiences that they've had with providers who have violated their rights for informed consent or even their desires that they've already communicated to that provider. Now, informed consent means exactly what those two words say. It means information that you as the patient are given. So this means before a provider does any sort of intervention or any sort of procedure, they first explain it to you. They explain the ins and the outs of the procedure. What's going to happen? What are the benefits? What are the risks? You need to know all of that information, and any additional questions you might have, you need to ask before they begin that procedure. You as a patient have a right to have all the information possible and all of your questions answered before they ever begin anything. Secondly, consent. Consent is requesting your permission. And those little papers that they have you sign at the hospital, at the doctor's office, at your midwife's practice, here, sign here, this is your informed consent, that's not sufficient. If you walk away with questions about what will happen or what has happened, you have not been properly informed. So that's what informed consent is. Here's what it's not. It's not your nurse walking in saying, "We need to do this test now." It's not her coming up and just slapping a blood pressure cuff on your arm. It's requesting permission. It's not your doctor coming in saying, "I'd like to do a vaginal exam." It's not your nurse coming in and putting her hand on your arm and saying, "We need to start your IV now." It's not a provider coming in saying, "We're going to," and then beginning to do their intervention or their procedure. They have an obligation to inform you and to receive your consent. This is your body. This is your baby. Now, there are many things, many interventions that are really good things that help to protect you and your baby. And those things might need to happen in order for you to have a positive outcome for your birth. But in order for those things to happen, you need all your necessary information. So here are some questions that might empower you the next time the doctor recommends a procedure or intervention. The first one is Mom okay? Is there anything that needs to be done now? Is Mom healthy? Is she safe? Is everything going all right in this moment? The second question is Baby okay? Is baby's heart rate okay? Are they tolerating labor well? How are they growing in the pregnancy? In this moment, is there anything that needs to happen in order for my babies to stay safe? The third question is to ask if you can have some time to think about it. Then you and your partner can discuss the pros and the cons of that intervention or procedure and determine whether you want to progress with that. If it's for the benefit of mom and baby, absolutely. If it's the only option to obtain a healthy outcome, absolutely. Go forward with it. But go forward in the knowledge that you know what to expect and you have given your consent. I hope this information helps you to achieve your optimal birth and deal with any necessary interventions or procedures in a way that honors your rights as a patient and receives full and informed consent.